Whether we like it or not, whether we know it or not, whether we admit it or not, we are elected to serve customers. And the citizens of the state of Connecticut essentially are our customers. At a time when we are least secure, when we are hearing and listening and seeing crimes committed inside this country and outside this country and within the state of Connecticut, what we are trying to do in this piece of legislation is basically we are cutting the legs from under our public safety. We are taking money away from public safety, from our defense, from protection of our citizens. And we are taking that money away to plug a hole in the budget of the state of Connecticut. I say we, not I will not be supporting this bill. But this piece of legislation basically is taking money away from the protection of our citizens, from our protection, to plug a hole in the waste of the state of Connecticut. And that is unfortunate. And while we are taking money away from public protection and public safety, at the same time, this piece of legislation is cutting hospitals and funds to hospitals by $30 million. I heard Representative Walker speak about it earlier. By $30 million. So God forbid, whenever we have a problem and the people come to an emergency room to be treated, they will not have the services they need and they desire in the emergency rooms simply because the hospitals are cut, the services are cut, therefore personnel are going to be cut, essentially. So cutting hospitals is something that should not have been done or be done now and in the future. Essentially, Mr. Speaker, we say that now healthcare is great in the state of Connecticut and in this country, but really it is not. I am affiliated, and I know a hospital in the city of Waterbury where this year alone in the emergency room, they served more than 60,000 patients. 60,000 people came to a hospital emergency room in my city of Waterbury. And basically those people came because either they have no insurance, they are underinsured, or they needed to be taken care of, and they did not have a private doctor, so they came basically to the emergency room. And the hospitals are taking the rap of all of these policies that are being implemented. So the state of Connecticut cuts them, cuts their Medicare, cuts their Medicaid, cuts their funds, but we still say to hospitals, you need to take care of the people who are underinsured and uninsured. And you figure a way of doing it and taking care of it and of them. At the same time, Mr. Speaker, what we are doing is we're taking money away from developmental services. And who are our customers in developmental services? The needy, the vulnerable, the handicapped, the mentally disabled. These are the people that are being hurt by this bill that is before us right now, Senate Bill Emergency Certification 1601. These are the people who are being hurt. And then, after that, we are continuing to raid people who are our future. So, Mr. Speaker, I look at the vocational technical schools. The vocational technical schools, quite honestly, are very important to us, very important to me. And allow me to explain, probably to the entire state of Connecticut, what the VOTEC school means. There are students in the VOTEC school, primarily in inner city schools, who come in to learn a trade. And they come in to learn a trade, and they are supported by the state of Connecticut. So now what we are doing in this bill, I can see what we are doing, what I am not doing, what this bill is doing is cutting the legs from under the VOTEC school. And the state of Connecticut, I must admit, I say it every time I speak, wherever I am, I talk about the wonderful apprenticeship program that the state of Connecticut has. In my place of work, Mr. Speaker, half of my employees came from the VOTEC school. through the apprenticeship training program. So what we do is we put them on the apprenticeship training program while they are students, supported by the state of Connecticut. We pay their fees, their annual fees, we feature them, and then we groom them to become tomorrow's skilled workforce. And I do have employees who graduated from the vocational technical school and now earning anywhere from $60,000 to $80,000 a year, plus health insurance to them and to their families, where they go out and they work and they spread their wealth around their community. So by cutting the legs from under the vocational technical schools, essentially what we are doing is we are cutting the legs from under the youth of our state, the people who are going to really be our future. These are the people who are going to work for manufacturing companies. And that is fine. It's great that we talk about biotech and we say we are helping biotech. But Mr. Speaker, the future of our manufacturing process is not so much in biotech. My biotech is all research and development at this time. I am very much involved in the manufacturing process. And the manufacturing right now is the heavy manufacturing, the tool and die, the manufacturing of mail sorting machines, or defense, or photo processing. These are the manufacturers who are working right now, stamping and production lines. These are the manufacturers who right now are the bulk of our state and the ones who are putting wealth in our state. So what we are doing right now is we're cutting the legs from under them. Those kids who are going to become our future, working in manufacturing, we are taking them out of the equation because we are saying we're going to cut the vocational technical schools. And that is totally and completely undesired, Mr. Speaker. And I want to tell you a story, quite honestly. Last year, talking about the waste in the state of Connecticut, and I hope everyone is listening to this and everyone hears this, talking about waste in the state of Connecticut, that one of these days, somebody has to take the ball and say, we are going to cut waste in the state of Connecticut. Last year, I had surgery on my shoulder, rotator cuff. I had 3 tears, plus my bicep was totally and completely shredded. They had to sew it together. So I am totally and completely attached to my shoulder, carrying a sling, and I happen to be at the mall in Waterbury. And I see a gentleman sitting outside and said to me, Mr. Noujaim, I see that you had surgery. I said, yes, I did. He said, what was the extent of your surgery? And I said to him, I had 3 tears and my bicep was shredded. He said, yes, I had surgery too. I said, great, what did you have? I had 1 tear. Really? How long have you been out of work? He said, 3 months. Well, why 3 months? Because I've been out 3 months. I am not cleared yet to go to work. And I asked him, who does he work for? And he told me the agency of the state of Connecticut. So 1 tear, 3 months out of work, 3 tears, bicep, totally and completely bicep shredded. You know how long I was out of work, Mr. Speaker? 3 days. 3 days out of work because I work for a private enterprise. And that gentleman works for the state of Connecticut. Why wasn't he working? And these are the issues that we face right here in the state of Connecticut. These are the things that one of these days somebody is going to say, we are going to look into the waste that is really generated right here in the state. That's how we save money. We save money by cutting the waste, not by cutting vocational technical schools, not by cutting manufacturing, not by cutting the apprenticeship training program. These are things that are very important for the state of Connecticut, and we need to take care of them. And Mr. Speaker, I would like, through you, if I may, just to ask one simple question. I tried to find it in this bill, but I have not been able to find it in this piece of legislation. Through you to either Representative Walker or Representative Berger. I had heard that this bill has in it $35 million out of the transportation fund to plug the hole in the budget. I just heard it. I was not able to see it in the legislation. I would just would like to ask if this is a true statement or not true. Through you, Mr. Speaker.
Representative Berger.
Yes, thank you, Mr. Speaker. And
It's encouraging to see that the recuperative powers of Representative Noujaim are on display here tonight, and congratulations on your speedy recovery, Representative Noujaim. In answer to your question, there is, if you'd like to call it a diversion, there is a delay, which in the monies that would flow into STF of $32 million. And just as a way, through you, Mr. Speaker, of a quick explanation, currently, STF is using sales and tax revenue equal sales and use tax equal to $17.6 million, which started to be taken as of October of 2015. This creates a scenario where the diversion will now initiate December 1 of 2015, through you, Mr. Speaker.
Representative Noujaim.
Thank you, Mr. Speaker. So the bottom line, no matter how you slice it, is that we have taken some $30+ million out of some pocket of our revenues and switched it someplace else, and that was supposed to be in transportation. Am I correct, through you, Mr. Speaker?
Representative Berger.
Through you, Mr. Speaker, I probably won't see it that way. If the good representative would like to look at it that way, there's still plenty of money within that fund, and also in the ability for the commissioner to get savings through DOT efficiencies. So there are projects ongoing. For a further explanation, if I could, Mr. Speaker, there are projects ongoing that are not affected by any of the $32 million that will be taken from STF with a diversion that will start in December 1 of 2015. Through you, Mr. Speaker.
Representative Noujaim.
Thank you, Mr. Speaker. I appreciate my wonderful colleague from Waterbury's explanation. But I think the question that I asked will probably have one simple answer, one word, either yes or no. And that's what I like to know. Is that a yes or a no, through you, Mr. Speaker?
Representative Berger, believe you've answered the question, but would you like to elaborate any further?
Well, if the good representative would like to rephrase.
Representative Noujaim, can you rephrase the question as to what you'd like a yes or no answer to?
Of course, Mr. Speaker. The question that I'm asking for a yes or no, are we shifting $30+ million from one account, which is primarily the transportation account, to another account to plug the gap in the budget that we are trying to right now to plug? Through you, Mr. Speaker.
Representative Berger.
Through you, Mr. Speaker, there's a delay in the diversion of $32 million. That delay will now the diversion will now take effect January 1.
Representative Noujaim.
Thank you, Mr. Speaker. I truly appreciate this, and I would like to thank Representative Berger for his well wishes on my speedy recovery. But besides that, I would like to ask another question of Representative Berger for the VOTEC education. How much are we taking out in this bill from the VOTEC schools? Through you, Mr. Speaker.
Actually, Representative Noujaim, I believe that's a question that's more appropriately asked of Representative Walker.
Thank you, Mr. Speaker. I will direct it to Representative Walker.
Or Representative Berger, would you like to answer that question?
Yes, Mr. Speaker, through you, if I could.
Sure.
There is, on the appropriation side, I believe the figure is roughly $1.3 million of an appropriation of $167 million, through you, Mr. Speaker, that the state of Connecticut appropriates for the VOTEC system. Through you, Mr. Speaker.
Representative Noujaim.
Thank you, Mr. Speaker, but it is still a cut no matter what, in my opinion. And these are the things that we should not do. We should try, essentially, to find savings elsewhere in order for us to plug the hole, rather than trying to take it from the students, the kids, who are the future of our society. I mean, when we all get old, when we are all no longer here, those kids are the ones who are going to replace us. These are the people that we need to help them. And right now, in this piece of legislation, we are not helping them. So thank you so much, Mr. Speaker. I truly appreciate your consideration and the time you allowed me.